When you first hear the news, you are going to be a parent. It can be an exciting time. Sharing the news with loved ones, picking out the baby names, decorating the nursery.
But there can also be concern for the well-being of your child. You want to give birth to a healthy baby, but with so many diseases and disorders, it can really rattle your nerves. That's where genetic testing can come into play. According to the National Institutes of Health, genetic testing identifies changes in chromosomes, genes, or proteins. The goal? To confirm or rule out a suspected genetic condition, for instance, Down syndrome. The NIH says genetic testing is also used to help determine a person's chance of developing or passing on a genetic disorder. Infants, children, and adults can undergo genetic testing. Even expecting parents. Once the test is taken, the NIH says it may take up to several months to get the results. So as you can imagine, that can be very nerve-wracking for mom and dad. But now a simple blood test is offering reassurance. 32-year-old Maria Elena Noto is having a simple blood test to check her baby for genetic issues. Her last sonogram showed a possible marker for Down syndrome.
Hopefully everything is fine and I could just continue to be happy with the rest of the pregnancy.
New research shows this prenatal test is much more accurate than standard screening, even in low-risk women. The test measures fragments of DNA that are circulating in the bloodstream. If the counts are too high, it suggests the baby has extra chromosomes present.
With a new study, there's tenfold reduction in false positive rate.
While the test is only offered right now to women considered high risk, researchers say it may be available to all pregnant women in the near future because its accuracy means fewer women will need to follow up with amniocentesis.
Amniocentesis, it's an invasive technique, so there is always a small risk of miscarriage. And it is a 99%.
Noto liked the idea of a non-invasive test.
I really just don't want the risk off a bit of miscarriage. I really don't. And I'm okay with whatever God gives me.
Doctors say, given earlier test results and Noto's age, the chances of her having a baby with Down syndrome are low. Test results take about 7 to 10 days. And researchers hope this kind of genetic testing will also be available to low-risk women in the next 2 years. Now, that's not the only advancement when it comes to genetic testing. Jimmy, you have more on that.
Yeah, Lisa, there's no question that we've come a long ways when it comes to medical advancements and testing. Years ago, who would have thought you could test your cholesterol level from the comfort of your home or test for common allergens? And for women, there's even a home fertility screening. Well, now advancements are even making genetic testing possible at home, a screening that may identify genetic markers for many genetic diseases. Joining us today to tell us more about this are reproductive endocrinologist Dr. Jessica Spencer and Caroline Gold, whose daughter suffers from a rare genetic disease. Thank you so much, ladies, for joining us.
Thank you.
Thank you for having us.
Caroline, let me start with you. The remarkable experience that you have with genetic testing. Tell me about that.
Before my husband and I got married, we knew that we should be tested for diseases that were common in the Jewish population. So we both went to our doctors and asked them to test us for these diseases, and they both tested us for what they thought was a complete panel of diseases. Our second daughter, Eden, does suffer from one of these genetic diseases called mucolipidosis type 4, or ML4 for short, which is a disease that both my husband and I are carriers of and could have been avoided had we had proper testing prior to having a child.
Right.
Doctors say that children with ML4 will never learn to walk, they'll never learn to talk, they'll have a maximum mental capacity of about 18 months, they'll go blind by the time they're 12, and they will have a limited life expectancy. As you can see from the picture, Eden is beautiful. She has a beautiful smile, a beautiful laugh, but it's a hard life. She works hard every day. She has hours of therapy. She'll never run and jump and play like other children. She won't go to first grade like the other children her age.
Right.
And
wow.
She tries something new every day.
That's quite a road you have ahead of you. Dr. Spencer, let me ask you, the genetic testing, what can we get from this?
Genetic testing is about information. So if in the case of a J-Screen, this nonprofit, what it is it's helping people identify themselves as being carriers for what's called an autosomal recessive disorder. So J-Screen screens for 80 diseases. So you wouldn't have any family history of this disease. You wouldn't necessarily have a cousin that was affected. And so the only way to figure out if you're a carrier is either through screening, genetic testing, or when you have your first baby who's affected. So the point of genetic screening is to identify those couples who are most at risk of having these babies before they conceive, and then counseling them about what options they have to move forward to reduce their risk of having a baby that's affected by one of these diseases.
So the J screen, that's a home process, is that right?
Yeah, it's a kit. They collect a saliva sample and send it back. So you don't have to do it in the doctor's office, but you will get a report that you can share with your doctor. And importantly, if you test positive for anything, a genetic counselor is available to explain these test results to you and your partner, to help you understand what the disease is that you tested positive for, what the risk is, and help refer you to get further counseling for moving forward.
Are you comfortable with its accuracy?
Yes, I mean, it's an accurate test. It's done by sequencing. It's highly accurate. And it's quite comprehensive too. A lot of genetic test panels, like the one that Caroline had previously, are not that comprehensive, and this one really is. And so I'm very confident in its ability to pick up genetic problems.
Okay, well, I want to ask you a question here, and it almost sounds insensitive. Please forgive me. I don't mean for it to be that way. Is the J screen specifically for Jewish genetic disorders?
No, that's a really good question. So it was initially started that way. Many of the diseases that are in the screen, more than half of them are carried in non-Jews. So for example, cystic fibrosis, sickle cell anemia, or sickle cell trait, these are things that are found in lots of people in non-Jews, and they are screened for.
Dr. Spencer, thank you so much for your time. Carolyn, thank you so much. Now, if you'd like to read more about Carolyn's story and what she and Dr. Spencer just had to say, all you have to do is go to WBOC.com and click on our picture at the top of the page. You heard Dr. Spencer say the screening can test for 80 genetic conditions, including one she mentioned, sickle cell anemia, as well as spinal muscular atrophy, northern epilepsy, and cystic fibrosis. It is important to know that if you're considering an at-home genetic test, the NIH says it's a good idea to first discuss it with your healthcare provider or a genetic counselor. So we just mentioned cystic fibrosis. That genetic disorder affects more than 35,000 people. Up next, we take a look at some of the advances in the cure for the disease and learn how it could be extending years to these children's lives. Plus, clinical research, a big reason advances like those are being made.
This drug that's out there actually has shown pretty successful rates, 60 to 70%.
We're going to find out about a new study giving hope to those with lung cancer. Delmarva Life will be right back.